Have you ever wondered about the immense impact a tiny mosquito can have on human health? Imagine a world where a single bite from this minuscule creature can lead to a life-threatening disease. This is not a world of fiction, but reality for many people across the globe. Welcome to the world of malaria. Malaria, a deadly disease spread by mosquitoes, is a global menace. It is prevalent in over 90 countries, putting at risk almost half of the world's population. Every year, millions of people fall ill due to malaria, and hundreds of thousands lose their lives. The disease has a severe impact on health, causing high fever, shaking chills, and flu-like symptoms that can be fatal if not treated properly. In the most severe cases, malaria can lead to complications like anemia, respiratory distress, and even cerebral malaria, turning a simple mosquito bite into a potential death sentence. Indeed, malaria is a silent assassin that wreaks havoc in our world. Behind the grim reality of malaria, there lies a staggering array of facts and figures. Let's delve into some of these now. Malaria, an infectious disease caused by Plasmodium parasites, is a global health crisis. The World Health Organization estimates that there were over 229 million cases of malaria worldwide in the last recorded year. That's equivalent to nearly 3 times the population of Germany falling ill from this disease. The death toll is equally alarming. In the same year, malaria claimed the lives of approximately 409,000 people. To put this into perspective, that's more than the entire population of Belize perishing in a single year. Geographically, malaria is predominantly concentrated in sub-Saharan Africa, which bears a disproportionately high share of the global malaria burden. In fact, 94% of malaria cases and deaths occur here. Now let's talk about the high-risk groups. Children under the age of 5 are the most vulnerable. They account for 67% of all malaria deaths worldwide. Pregnant women and their unborn children are also at high risk, as malaria can cause severe maternal anemia, stillbirth, and low birth weight. Furthermore, malaria carries a significant economic burden. It's estimated that malaria costs Africa $12 billion every year in lost GDP. This is due to factors such as healthcare costs, lost productivity, and decreased school attendance. However, these figures don't tell the full story. Each number represents a life lost, a family impacted, a community burdened. The ripple effects of malaria extend far beyond the immediate patient, affecting entire societies and economies. These figures are not just numbers, but represent real people suffering from this dreadful disease. The battle against malaria is not just a fight against a disease, it's a fight for human lives, for economic stability, and for a future where no one has to live under the shadow of this deadly parasite. Understanding malaria begins with understanding the life cycle of its causative agent, the Plasmodium parasite. Our journey starts in the gut of a female Anopheles mosquito, the only place where the Plasmodium parasite can mature and reproduce. When this mosquito takes a blood meal from an infected person, it ingests the parasite's microscopic forms along with the blood. Over a period of 10 to 18 days, these forms grow and multiply inside the mosquito, eventually landing in the insect's salivary glands. Now, when this infected mosquito bites another person, it injects the parasites into the human bloodstream. These newly introduced parasites travel to the liver, where they hide out and multiply. This liver stage is asymptomatic, meaning the person doesn't feel sick yet. After about a week, these liver-dwelling parasites burst out and invade red blood cells. The parasites continue to multiply inside these cells, causing them to burst open every 2 to 3 days. It's this bursting of red blood cells that triggers the classic symptoms of malaria: fever, chills, and anemia. But the parasite's life cycle doesn't end there. Some parasites transform into sexual forms, which are then picked up by another mosquito during a blood meal. These forms mature into new parasites inside the mosquito, ready to infect another person, and thus, the cycle continues. But what happens if malaria isn't treated promptly? The parasites can cause severe complications, including kidney failure, seizures, mental confusion, and even death. Pregnant women and children are particularly vulnerable. The parasite can also lie dormant in the liver for months or even years, causing relapses. But don't despair. While the life cycle of the Plasmodium parasite is complex, understanding it helps scientists develop new ways to interrupt it. From vaccines that block the parasite's entry into the liver, to drugs that kill it in the blood. The life cycle of the parasite is a crucial piece in the malaria puzzle. And with every piece we place, we move one step closer to solving this deadly disease. The fight against malaria is a race against time, and every second counts. In this critical race, the strategies we employ are threefold: prevention, diagnosis, and treatment. Each plays a pivotal role in curbing this global health menace. Prevention is the first line of defense. It's all about minimizing exposure to the disease-carrying mosquito. This is largely achieved through the use of insecticide-treated bed nets and indoor residual spraying. These measures have proven effective in many regions, but the ever-adapting mosquito continues to challenge these strategies. Hence, the constant need for innovative preventive measures. Early and accurate diagnosis is the second crucial step. Rapid diagnostic tests, or RDTs, have revolutionized malaria diagnosis. They're simple, quick, and require only a drop of blood. They've enabled health workers, even in the remotest parts of the world, to accurately diagnose malaria within minutes. However, as with any test, RDTs aren't foolproof. False negatives and positives can occur, underscoring the need for continuous improvements in diagnostic technology. And then comes treatment. Artemisinin-based combination therapies, or ACTs, are currently the most effective treatment for malaria. But the emergence of drug-resistant strains of the malaria parasite poses a significant threat. The quest for a potent malaria vaccine is ongoing, with RTS being the first to receive a green light for use in children in sub-Saharan Africa. Research, indeed, is the backbone of this fight. It's through research that we've made strides in understanding the malaria parasite, its transmission, and how to combat it. It's through research that we have developed effective preventive measures, diagnostic tools, and treatments. And it's research that will continue to pave the way towards new and improved interventions. The battle against malaria is complex and multifaceted. It's a battle waged on multiple fronts, in labs, in clinics, in communities, and in policy-making halls. It's a race against a tiny but mighty adversary, and the stakes couldn't be higher. The battle against malaria rages on, and it's a battle we must win. Can you imagine a world free of malaria? Picture this: a world where children don't miss school due to this illness, where families don't have to set aside their hard-earned income for treatment, where communities can thrive without the burden of this disease. We've navigated the murky waters of the malaria menace, dissected the facts, and unraveled the life cycle of the parasite. We've seen the valiant fight against malaria and the strides we've made. Yet the battle is far from over. It's a collective endeavor, one that needs us all to roll up our sleeves. From researchers developing vaccines to individuals using preventive measures, every action counts. And what's at stake? A world where the economic burden is lifted, where health disparities are reduced, and where millions of lives are saved each year. A world without malaria is not just a dream, but a goal towards which we all must strive.